Carotid artery disease is the buildup of cholesterol and plaque within the carotid artery, which is the artery that exits the heart and delivers blood flow to the brain. The risk of this plaque buildup that causes inflammation is that it can either cause little pieces of plaque to break off and go to the brain, or it can cause clot to form, and that can break off and go to the brain and cause a stroke. So the whole concept of trying to figure out who has carotid artery disease is all about trying to figure out before they become symptomatic. Meaning, I don't want to wait till my patient has a TIA or a mini stroke or a full stroke before we realize that they have carotid artery disease. And the way that we look for the disease is very simple. It's just a carotid ultrasound. It's not painful at all, and we can determine the blood flow through the carotid artery in the neck. We can determine the speed of blood and determine how that correlates to the degree of stenosis or the degree of narrowing of that blood vessel. The U.S. Task Force actually does not recommend to screen the general population, but there are some people that we should look for this in. Those who smoke, have high blood pressure, high cholesterol, diabetes. If they themselves or a family member have a heart attack or stroke, they should be screened. What's also important is those people who know that they have peripheral arterial disease, which is the similar disease process, build up cholesterol and plaque in the blood vessels to their legs. We know that up to 60% of those patients also have carotid artery disease, and we should look for the disease in those types of patients. One thing we do know about carotid artery disease is that if it's stable, meaning if year after year it's minimal, then the likelihood of progression and symptomatology is very low. However, if you have rapid progression, what that means is if you show up and you first have mild disease at 50%, and then the next 3 months it's 75%, and it's progressing rapidly, that is the sign that carotid artery disease may lead to symptomatology, and that's the type of person we want to follow more closely.